Thyroid nodules are a health problem affecting 30 to 40% of the population. Physicians generally detect thyroid nodules by physical examination or after performing an ultrasound of the neck. Frequently, the patient undergoes a needle aspiration biopsy of the nodule to determine its nature. While in 80% of cases there's a definitive diagnosis of benign, 70%, or malignant, 10%, in 20% the result is indeterminate. An indeterminate result leaves the patient with uncertainty. In these cases, there's a 25% risk of having cancer and a 75% chance of it being benign. This poses a dilemma. Should the patient undergo surgery to remove the nodule or wait for further developments? The 25% risk of cancer is often enough to convince the patient to undergo a surgery. As 3 out of 4 indeterminate outcomes are benign, most of these surgeries are unnecessary. Unnecessary surgery exposes the patient to many surgical risks and to significant avoidable health costs. A new thyroid genetic classifier could reduce the burden of unnecessary surgery, uncovering the nature of thyroid nodules where tissue biopsies can't. The diagnostic tool uses a gene expression classifier to identify whether a thyroid nodule is benign or malignant. The genetic classifier was developed sequentially using a set of benign/malignant tissue biopsies, followed by confirmation on a set of FNAs. When the classifier predicts that a nodule is benign, there's a 95% to 98% probability that this is true. It can identify over 85% of cases with indeterminate results in which the thyroid nodule is benign and surgical interventions are unnecessary. The new diagnostic tool, based on qPCR, could be put in a small kit that physicians can use directly in their lab. This simple test can be performed in local reference labs using widely available molecular diagnostic platforms. It's a great option for physicians worldwide, providing a much-needed diagnostic tool for thousands of underserved patients globally. This new diagnostic tool could drastically reduce healthcare costs and unnecessary thyroid surgeries. It addresses an important global issue, offering a simple and highly performing solution for thyroid patients around the world.